All right.
Okay, let's get started. Thank you, Brian, for joining us. We're very excited to have you, and I'm quite sure everybody else is delighted to have you as well. So I think just to give people a sense of PaceMate and sort of what you guys have done, PaceMate is what I would call the leader in the cardiac remote patient monitoring space. The company was founded in 2015. It's grown rapidly. And what I wanted to start out with, Brian, is just in terms of the genesis of the company, sort of how the founders brought it together, the inspiration for the idea, and then we'll start to flow into some of the things that are required as you sort of build an enterprise class software company in the digital health space. But it's a great story, and I thought maybe we could talk a little bit about how the company was founded and your background working at a health system at St. Vincent's in Birmingham, and I'd love to hear a little bit about that.
Yeah, appreciate it, Lou. First and foremost, thank you to the Tech Hub for the invite. Congratulations on taking your role there, Lou. And as a good leadoff hitter always does, I'll shoot for about 33% accuracy of getting on base. And as long as I get past 33, 40%, we'll be doing great. Yeah, so the origin story of PaceMate is pretty interesting. For many years, I was Brian Faulkner. I'm the COO here at PaceMate. I spent many, many years in the field working for companies like Medtronic, St. Jude Medical, Abbott. Did a few startups before getting into the big CRM space or cardiac remote space, where we're putting in devices, pacemakers, loop recorders, defibrillators, working in a very niche spot in the hospital called electrophysiology. And I'm not sure that everybody's aware of that, but if you want to dive deeper into that, put some things in the chat, and I've got it going over here on the side, and I can always expand on topics if Lou and I are moving pretty fast. So working in that space, I was leaving electrophysiology from one company and moving to another, leaving Medtronic and moving over to St. Jude Medical from a recruiting process. And I went to a competitive hire training. And while I was at that training, I met two individuals that happened to be co-founders later on in life, happened to be co-founders of PaceMate, named Noemi Ray and Jason Hale. And as we were in this very small training together, and as most people do, going out in the evening, enjoying dinner and a glass of wine over in Austin, Texas, we started to think about how to package the products that St. Jude was making, and how we were going to sell those into the field. And we started talking about the differentiation between those products and what Medtronic offered. And one of the very unique things that they had was remote monitoring on their devices, meaning that these implanted devices that are in the chest would talk to the cloud all day long and send information up to the cloud. Well, that led us to start thinking about, well, who monitors all this stuff? And obviously, working in the field, Lou, we were in the clinics all the time, and we saw all the data that was coming in. And it was one night in Austin that we were sitting there, and we thought we should start a remote monitoring company. That's really what we should do. And truth be told, we came back from that. Jason lives over in South Carolina. Noemi was living in Louisiana. I live in Birmingham. So all in the Southeast. And within about 3 or 4 months, Jason was going through some change in his life and decided to leave St. Jude and go out on that edge and start that company. And one of the first people he called is actually on this call right now, and Becky Manley, who helped decide what's the name of this company going to be and how's it going to go and where is it going to go. The first person he called was Noemi, because truth be told, she's a lot prettier than I am. And then he called me to say, hey, why don't you come over and let's do this. And at the time in Birmingham, it just wasn't the right move for me, but I stayed in very close contact with Jason and Noemi through the next year and a half as an advisor to a very small company that was starting up out of a garage. And at that same time that they were starting up, there was a really young startup down in Sarasota called Biocinetic, which are the two other co-founders of our company. You'll hear the names Trip and Chip as I speak to those. Trip's our CEO. Chip is our Chief Technology Officer. They were building a software to somewhat do the same thing, but they didn't really have a background in cardiology. They just knew through Trip's experience in the hospital working in robotic surgery that there was a need. He had heard of this need, and he wanted to kind of try and start something up in that space. So we talk about digital platforms and where people connect. Fast forward about 6 months or so into the process, LinkedIn connected Jason Hale with Trip. And through that connection, Jason went down and Trip and Jason got together, and Biocinetic ended up purchasing PaceMate, the garage company that was trying to do everything by hand. And a digital platform was formed, a digital health platform was formed called PaceMate Live, which is what we have now. It was after that merger that I came on as employee number 7. And we started to grow. Jason managing the product itself, Noemi managing the clinical functions of the company, and I was managing all the commercial activity. And at that time, we had about 1,000 patients or so that we were working with. And in the last 4 years, since that time, we've gone from that level to now having 125,000 patients that we work with every day. 75 very strong customers that we work with, about 130 people that we employ, and have gone through just a dramatic amount of growth over the last 4 years. And we've had to really expand our technology platform to suit that. But looking back, it seems like a long time ago, Lou, but I know it's just right around the corner. You're on mute, Lou. I'll tell you that 15 times tonight as we go.
I don't know how to keep going on mute, but I don't think there's anything more exhilarating than working in a startup and being a founder. But I also don't know that there's anything that's more exhausting. Your chief bottle washer and cook and all of that. So, but in terms of in terms of digital health or digital health and thinking about technology and identifying pain points, where was the industry in terms of RPM? Like where were there competitors? There's PaceArt, which is an offshoot of a large, bigger player, but give us a sense of the market at that time. And of course, it's gotten much more competitive than it was before. I mean, there's a lot of new entrants in the field.
Sure.
Give us a sense of sort of where you were and what the landscape looked like, because it certainly changed.
Yeah, absolutely. So COVID definitely made a change, but I'll go back further than that and say that the market was beginning to go in this direction about 7 or 8 years ago. There was a large regulatory body that we work with called the Heart Rhythm Society that came out with a consensus statement about 7 years ago, talking about remote monitoring being the new standard of care, and that now that all of the manufacturers of the devices that we implant in the field are moving towards this technology, that it should be readily adopted. What they didn't get to in the consensus statement was how to do that, or what was that going to take, or what operational challenges that would bring if you decided to take your medical practice, and move it into a robust monitoring type center. There were many big centers around the country that were doing this. Some large ones like the Ascension Hospitals, Sanger Heart and Vascular up in Charlotte, your big name spots like Mayo and Duke and those places. Of course, they had programs, but that's not where all the people live. None of what I really talked about were the 25 million people that are down in Florida that are walking around and spending half their time in New York and half their time in Florida. And so what I saw and what Jason and Noemi saw was a wrinkle in the market that was going to start to turn into almost a wave. And as that wave was going to grow, I could see 4 or 5 years from now, we want to be aligned exactly where we are today. And honestly, it just came from working inside those clinics and understanding what the problems were, exactly what the pain points were, to be able to take the risk at the time. Because it continues to be hard. I'll tell everybody on here, it continues to be hard, but it was really hard at that point. You're taking large financial risk. You're trying to break into a market that's extremely difficult. And at that time, there were only 2 or 3 players. PaceArt, as you talked about, is a Medtronic product. It was not a SaaS solution, but an on-prem solution that was deployed into the hospital as a server, and that server basically just collected data and clinicians interacted with that server there. What we were trying to do was something completely different. It's to create a SaaS solution, go into a live marketplace, hook up with all the electronic health records, be able to deliver information into the health record, yet use bi-directional APIs to pull information back into PaceMate, meet the needs of the clinicians, do this in a real-time environment, and all those things. When you think about delivering all that with only a couple people, only a couple clinicians, and a very few amount of developers. So to be honest, we didn't know what we didn't know. And I think when you're very early and you're in a startup like that, you're a little lucky to not know all the challenges you're getting ready to face. And we found ourselves in the mix pretty quickly. And then once we started, commercializing the product and moving out across the country, we really started to pinpoint the need. And we found exactly where we needed to go and who we needed to talk to, and started to understand the cycle to get it in to the health systems.
So when you think about the founders' backgrounds, you have, Trip, whose background is in robotics, Noemi, and you in cardiology. But did any of you have real software development experience? It seems to me that maybe you didn't, and so you've learned that along the way. Which is
I would say I would say that absolutely none of us had software development experience.
Right.
I think we all have worked in product over time, because when you're in the the cardiac space, you're really interacting with a lot of products, and you're giving a lot of feedback to the developers at those larger companies. Here we found ourselves working in the development space, in the R&D space, and in the marketing space, in upstream and downstream, trying to figure out exactly what you need to do, and literally go from the first call in the morning, which might be a sales call, to then an operational call, and then bounce directly into a product prioritization type call, and then over here. And Chip, who is our CTO and lead developer, is absolutely phenomenal, but no cardiology background. So Noemi, who's a nurse, and Jason, who's somewhat like me, a very strong cardiac background. We spent a lot of our time translating the language, so to speak, on what we needed from this HL7 information that was coming into our SaaS, and how we wanted to present that information, and working with the developers to create that in a graphic interface that was going to be usable. So you're on mute again, Lou. That's two. Keep putting them in the bucket.
Well, you're batting 33%. I'm working on my average up to that. So tell me a little bit about, sort of, because it does take a lot of moxie, right? So you've got this fledgling software product, you think you've got a market fit, and you go start knocking on doors. And so I think, every great entrepreneur is sort of saying, okay, I think I get it. I think this is a huge opportunity, but you really don't know until you start selling it. And so share with us a little bit about sort of those early days, right? Because you're selling an enterprise software is a major commitment, particularly at a large institution that is risk averse. And, here you guys come in, right? With rubber bands and Band-Aids and all of that at the earliest stage. And now it's the most sophisticated product. In fact, PaceMate was named in 2021 Healthcare Technology Report, one of the top 100 healthcare technology companies in the United States. So you think about those early beginnings, and where you guys have gotten today is remarkable. But tell us a little bit about that. Your sort of sweaty palms and sort of sitting across from folks, really trying to sell something that is a pretty big enchilada to bite off, right?
Yeah, I think the best way to look at it is very conceptual, right? So when you were first looking at your iPhone to decide whether or not this is what you wanted to put in your hand, if you pull an iPhone out today and look at what you have now versus that iPhone 3 or whatever the first one was that you put your hand on, and then you look back at the videos of the Apple conferences coming together, and you hear the stories of, well, we're going to sell them what they don't even think they need at this point, or they don't know they need. I'm certainly not comparing us to Apple, but I'll put our product in the same type of relationship, where it is, we were walking in where we knew the solution was needed, but very, very risky situation to walk in and bring a SaaS into a market of healthcare where nurses are delivering all of that quality healthcare right now without business tools at all. And so we were viewed very early as a competitor to a nursing workflow and a traditional workflow. And so what we needed to do, and we deployed a strategy, a very a good strategy in the beginning. Now we look back and say, okay, but a contractual strategy where we put ourselves into a complete risk situation with the customer. And so we had to prove ourselves, we had to prove our worth and our value. So we walked in 100% at risk with the customer and said, we'll create a contractual situation where if you make, we make. If you don't get paid anything on what we are presenting, PaceMate will not make anything on what we're doing. And I think that brought the walls down. I think depending on which business you have and many members of this group doing many different things, you have to find a place to meet your customer, especially in the beginning, and develop a strategy that's a win-win and explain that early and then build from there. And I'm happy to say that all those early customers, right? So our churn rate is extremely low, less than 1% to be quite honest. And in many occasions over the last 2 years, we're only post commercialization about 4 years. Our contract normally runs about 2 to 3 years, depending on what you sign up for. Many cases we have increased our price ratio. We've heightened our margin the second time around on our contract renewals. And then we've been able to move away from those at-risk scenarios now that we're 24 or 36 months into a contracting cycle with our customers.
So what would it feel like when you pulled in that first client? What was the feeling, if you can think about that, and sort of driving each other in the parking lot, and when you got the call, what was that?
Yeah, truthfully here, we had to learn how to celebrate, right? Because you're working really hard, and you've got to think about, okay, how do you stop and smell the roses a little bit? And I don't think we do that nearly enough. But really what we learned was the contract, we would start celebrating the contract and getting the signature. And very quickly, we would learn that didn't really mean anything in this business because the contract's really great, but now the hard work starts, the implementation, the integration, and all the different things you have to do to really get a healthcare system up and running. So we would celebrate, and then a month later, we'd say, well, that celebration didn't matter. So let's celebrate again when we get the integration done. But I'll tell you the largest piece for us and really moved PaceMate forward in the national scene was when we signed the Ascension Healthcare national contract. We went through about a year of transactional experience. I was leading that with Ascension to try and drive towards a national agreement. And we needed something to really move the business. And we actually started down there up there for most of you guys in Jacksonville. And we went in and we were working with an administrator there named Margaret Pate, who's just absolutely have been a champion for us. And she understood what we were doing. The physicians understood what we were doing, and they went to bat to help us get on the national agreement. And we worked all the way through, got that done. And now Ascension is one of our beachheads as we go around the country. We have many, many Ascension accounts and call them a friend.
So, when you think about the evolution of a company, you're sales focused, right? You've got to close deals in order to create cash flow and proof of concept that there's a product market fit. But you brought in Becky, who runs Fierce Marketing, early on, because I think you felt like because it's fairly early for a company to bring in sort of a skilled marketer because they're sort of bootstrapping it, and really not until they get in sort of past the sales part of the growth model and moving into some scale with marketing. But you kind of did that early on. Tell us a little bit about sort of how that transpired.
I'd love to talk about Becky. I see your smiling face up there. So cardiac electrophysiology is a very tight unit. And there's, coming from Medtronic, Jason and I both, and spending a lot of time in that big branding engine of Medtronic, we both are are very ingrained with the fact that you have to start your brand the right way, and you have to focus in on your brand even more than your marketing scheme itself. So there are two large meetings every year of the Heart Rhythm Society. You have to attend those. That's where all of the users are. And again, we're selling to a niche market of only about 2,500 electrophysiologists in the country. So you kind of get one shot to do it right, Lou, and that's where we sat back, and Jason, very wise in the beginning. Like I said, first call was to Becky to figure out what's this brand name going to be, and then from there it was, okay, how are we going to work on brand strategy and brand identity much more than marketing, and then how are we going to work on deep integrations with the electronic health record. So if you look back through our spreadsheets for the first couple of years, you'll see that we spent very, very little money on marketing. That wasn't necessarily our game at the time. We knew we needed the best product, and we knew we needed the best integration. And then we wanted to solidify our brand in the mind of the EPs that were going to be the thought leaders. So Becky's been just absolutely invaluable to what the company has done. And there's Becky's smiling face. And I think that we would not be where we're at today without Becky's guidance and Fierce's guidance and their ability to keep all of us on the straight and narrow, always protecting the brand. Even with the smallest pieces, Lou, just the little things that we put out there. And obviously we're spending a lot more now on marketing and talking to a lot more people, but from the website design to the way we present ourselves at Heart Rhythm Society to the things that we don't do. She's talked us out of many decisions before as well. So she's just a absolutely invaluable member of the team.
So really the industry, I think, was driven less on sort of technical tools like SEO and CRM and all of those things, although you've put those in place, and we'll talk a little bit about that. But really, I think the majority of the budget right now is spent on these very large industry conferences, which are kind of where your customers are, right? And then you've evolved that and started to mix in other types of marketing channels, like certainly social media is sort of a have to have. You've got HubSpot as a CRM, and you're using HubSpot not just for outreach and to empower your salespeople and the prospects to manage your prospecting and pipeline, but also now you're using that as a support mechanism for your customers to interact. So tell me a little bit about how that sort of evolved, going from brand to some of the foundational work. Obviously the website's sort of the cornerstone of that, but in terms of as a COO, thinking about the decisions that have to be made, because there are so many different channels and there are always finite resources. So, give me some thoughts, and I think people will appreciate that here, is sort of, from a COO, you're not a CMO, right? CMOs think about different things, but from a COO, you've got the rest of the business to deal with, right? You've got to allocate resources to operations and product delivery and the product development and the implementation and sales and all of that. But so how do you sort of see that? Some CEOs don't put as big a premium on it, which is sometimes reflected either in more of a tactical approach rather than a strategic brand level approach. And they also don't fund marketing in the way in which it will generate a return. So just give us a sense from a COO's perspective, how you sort of see marketing fitting into the mix, and maybe how that's evolved as we've, as PaceMate has gone forward.
Yeah, I think the tech stack has been very important to me through the years, and I think I need to also explain a little bit about how PaceMate is set up. Culture, very important as well. So we're not just a SaaS. We certainly are a SaaS solution that we put into the hospital system, into the cardiology office, but we also deliver professional services through clinical work, and then we also have another team called a communications team. So when you hear that 125 people walking around PaceMate every day, we're completely virtual and have been completely virtual since day one. Small brick and mortar down in Sarasota is where we get the mail, but beyond that, everyone is around the country. And again, small niche opportunity with electrophysiologists, but we're hiring in qualified nurses, or what we call cardiac device specialists. CCDS is the language there if you search it. So for me, I needed to set up something very early where all of these folks could communicate. So we adopted Slack very quickly as a communication tool in between the communications team and the clinical team. We then went out and adopted HubSpot because truth is that's what we could afford, right? Everybody wants Salesforce, but at the $300,000 price tag, it wasn't anything that this company really needed. And at that time, yours truly was the only salesperson. So give me something that I can work with. And I found HubSpot to be wonderful, quite honest. It has met our needs year in and year out. Doesn't necessarily mean it'll meet the needs next year, but it has certainly met the needs through the first 4 years and supported us in a lot of different ways. And then underneath the COO hat, or one of the hats that I wear, I also have the customer service department. There's R&D there. And then account management. So we have sales that sits over in the commercial department, and they're driving top line. But the way we manage those accounts and everything that we pour into those accounts all come through operations, which it kind of comes up through the tree. Lastly, we also adopted Teams. Zoom was our platform for all things sales, and we would present our product over Zoom, and I still feel that it is the best product that I have seen to present online. But Teams certainly worked for us more from an IT standpoint to house all of our materials and put all of our information in. All of our contracts run through there. Everything that we put out and bring back in all runs through Teams. But I want to circle back to the very beginning and say that the cornerstone of what we've done here at PaceMate is build a good culture. It started with Jason and Noemi. It started with Becky and Trip and Chip. I think I've helped pick that ball up and keep it going. I'm proud to say that we've not used any outside recruiters to find any of these people. All 125 or so have been either found by Noemi or myself or word of mouth. PaceMate has continued to grow. And then we've also used that strategy to find other sales opportunities. We bring in nurses and nursing staffs from around the country. And then obviously those people are connected to other cardiology groups in that area. They're introducing us to people. We set up a little referral fund inside of PaceMate for that to happen. And so we're driving internal sales out that way.
So we've got a couple of questions I want to jump into because we're about 20 minutes till the top of the hour. One, and I think this is such a great question and is a question that every entrepreneur asks themselves, which is, at what point did you decide to sort of raise capital? Where are you in terms of, series this and series that? Sure. What sort of culminated how that sort of was decided? Obviously bootstrapping to a certain extent, but you've got to have investors to take it sort of to the next level.
Yeah, so we're post Series A, moving towards Series B, and serious discussions about what that looks like. A lot of angel investment early, and I'll say that we decided to raise before COVID, and I just use that as a marker because in everybody's brain, everybody knows when that started. But we had started going into a Series A about 6 or 7 months before COVID started. And our plan there, everybody wants to know, okay, why did you decide to do that? And then what were you going to spend it on? We're knee deep in AI right now, guys. We're in machine learning. We're working on digital processing of EKG and what we call EGM. That's where, when I told you I could see over the horizon 5 years ago that the adoption was going to happen, very quickly after coming here, I could see over the horizon a little farther that yes, the adoption's coming, and then the AI is coming right after that. Then we'll have to get into how we're going to work with who's going to be working on the information, how the hospital's going to staff it. Those types of question and answers are in discussion now. So for us, it's about R&D, and it's about going deeper into the technology of this deluge of data that comes in from these devices. And then how do you more efficiently put that in front of the physicians? how do you stack that in a way that they can handle that? Because you very quickly realize, Lou, when you're out there in the field working with these physicians, that they're all overwhelmed. They absolutely cannot deal with the level of data that's coming through the door, and it's almost an impossible job that they hold. And we're just trying to support that in a way that we know will help. Obviously, it's got to continue to get better, and that's why we took the series.
Yeah. So in terms of pivoting, right? So every great entrepreneur and company has to pivot at some point, right? Think about Apple and some failure there, and Steve Jobs leaving and then coming back and so forth. Give us a sense of sort of the, if you've had any inflection points where you said, okay, well, because you've stayed true to that market, right? The RPM market, remote patient monitoring. Yeah. But at some point, where kind of pivots along the way did you have to consider, and did you have to implement?
Great question. I saw it in the chat, and I've been thinking about that one for a minute or two while we've been talking about the others. We've stayed pretty true to our scope, but we have pivoted in a way where there's a couple competitive devices or SaaS solutions out there that have branched out and gone into physiologic monitoring, and not just cardiac monitoring or cardiac signal monitoring. We've pivoted it to fast follow there a little bit, and we've set up strategic partnerships with companies like Biotel, another company called Preventus, a company called iRhythm. Some of you may follow. They have these patches that you put on your chest, and some of you may have had these before. Their Holter monitor is another name of it, or MCOT. So we pivoted there to go and get that information and bring those in. That put us into an R&D field that we had not been into before. We needed to do some development to be able to handle those signals and pull those through. I think that's made us much stickier with our customers, to use that term. It's put us into a situation where we've been able to spread out inside of the healthcare system and reach other end users that we weren't using before. And an example of that would be like at Jacksonville, we were talking about earlier. If you're in the cardiac electrophysiology space, you've got 5 or 6 users of your SaaS. The day that we decided to move into MCOT monitoring with that group, we moved out to about 65 users of the SaaS. So if you're developing a product and you know what your niche is and you know exactly where you are, as soon as you get a good base going, start to look around and see, okay, am I being penetrated from other areas, or is there anything else that I can capture still inside my space that I might not be offering right now? And I'd say, Lou, that those are our biggest pivots. We haven't gone down a negative pathway and had to come back because we've kind of stayed in our lane pretty well for the last couple of years.
Yeah. So if you think about digital health, and then let's answer this question and let's open it up to the floor, because there may be some additional questions, and certainly talk a little bit about the folks that are here, give them an opportunity to weigh in. But in terms of where it's going, because you look at COVID had such a tremendous impact on everybody's lives, personal lives, work lives. I don't know that the commercial real estate market will ever be the same. But if you think about how it may have affected your sales cycle, or how maybe it affected how the end user customer works with, did it accelerate adoption? Just give us a sense of how it's evolving and where it's going. Certainly telemedicine exploded. It's suddenly come back to earth a little bit, but give us a sense of sort of where your particular niche is going, and sort of how you guys have sort of wrestled with the last 2 years and across from sales and the end users.
Well, remember earlier on in the conversation, the consensus statement told us that it was the gold standard of how patients should be treated. What that consensus statement needed, honestly, was COVID, or a COVID-like event, to happen where everything stopped at the same time. And, obviously it affected a lot of businesses in different ways. For remote monitoring as a concept, it solidified the concept, right? So the days of having to walk in and talk about this should be the way that you should do something versus the way that you're doing it now, you really don't have to have that conversation anymore, quite honestly, because COVID is fresh in everybody's mind. Now, from the sales cycle, it slowed it down immensely. So the less you go to the hospital, the less that they do procedures, obviously the less money that they make. And if they have a workflow in place that does not need this new fancy shiny toy, then they're not going to pay for the new fancy shiny toy right now. But I'll tell you that exiting the tail end of what I'll call like COVID-1, before we started seeing the variants and all of those things, you started to see all the buying cycles that PaceMate was in starting to speed up, which caused many operational challenges in the business, because now all of a sudden we have to onboard all of these clients and we have to deploy the SaaS and we have to do all the training. We were in a nice rhythm and we were scaled for that model. And then all of a sudden we needed to up our scale very, very quickly. We were able to get over that. We're into a new scaling model now, but that bridge was a little bit tough to get through, for sure.
Yeah, no question about it. To think we were working for a large health system at the time, and the thought of these physician practices being endangered was so amazing, because you think about healthcare as sort of this insulated industry, but it was remarkable to see kind of how transformative it was to even roles and in areas within healthcare that have been reasonably insulated from dynamic changes in society and technology and so forth. But all right, so let me do this. About 5:49, I've gotten some great questions. I think, Brian, you've alluded to that here in the chat. I'd love an opportunity for anybody to answer their own or to ask their own questions if I didn't ask any of them that you were thinking about. So why don't we be able to do that? Nikki, can we open up the floor and let anybody ask Brian some additional questions?
Yeah, of course. Please feel free. Anybody that would like to take yourself off mute. If you want to do the little emoji and raise your hand, that works too. And then we can call on you. Or if you prefer to put it in chat, I'm happy to read it out. Anyway.
While the hands are coming up, Nikki, I see Davey's question there about what surprised us the most during the journey. Yeah. What would you say that you wish you knew before starting? There's a lot there, Davey, that I wish that we knew
right?
before. Exactly. The biggest surprise is honestly how quick the market has really moved. I certainly felt that the market was going to move, but the absolute deluge of resumes that we get every day, how we need to go through everything, how tough it is to really onboard people into the company, those types of things, that the HR pieces, none of us have an HR background. So we had literally, I think you should get a honorary degree in HR and in product design and development and all these things they should give to you after you walk through this fire for a couple of years. But we talked about the tech stack. I definitely want to throw this out there. We use Jazz HR for our HR, pretty much all things recruiting and all things around the company. We brought that in. We put all of our leaders, I put all the leaders onto Jazz HR, and it has been a wonderful piece of technology that we've brought in. And very early on, we were using another piece of our tech stack called GoCo. And once people were onboarded, I think GoCo has been a very valuable HR tool for us. We did not use it as a PEO, even though it is, but we didn't choose to use it as our PEO. We only use it for HR related activities. I see a hand on, yeah. Which one?
Question, Chris?
Oh, sure. Thanks. Hey guys. So Chris Faulkner, Modern Trials here. So breaking in and signing contracts with healthcare organizations is notoriously just below impossible without requiring an EMR integration. So if you throw that on board, I mean, you guys had to struggle with that. If you had anything that you would give to a fledgling company trying to do that as well, were there any sort of key things that you said, wow, if we had just known that in the beginning, that would have been helpful. I wish I had avoided that, or this was, the game changer?
Yeah. Everything security wise, Chris, I think is your name. So the contract's not the toughest piece in my opinion. Getting the yes is easy. Working through the contract negotiation is easy. The security reviews, depending on if you're bringing a SaaS solution in, make sure that your security is tight. Make sure that you've gone through and maybe even gone through a trial with a group. And then the other thing too is if you're planning on setting up multiple hospitals or you're going to different IDNs around the country, every questionnaire is different. Every security process is different. I wish we would have thought in the beginning to set up a central hub for that solution alone, to really speed up the process of security review once it starts with a group. So we embedded ourselves. We're an Epic App Orchard client. We went into the Athena marketplace through the More Disruption Please program. And then we're also a Cerner code developer. We focused there for 36 months, basically. The last 3 years before this commercialization year was all about setting up those integrations. You get a certain level of gravitas that you went through those securities and you passed those trials. So when you walk into a hospital system like an Ascension or like, pick Duke, for instance, and they say, oh, well, here's our standard security documentation. Don't worry, nobody passes it on the first try. You kind of feel good when you say, no, we do. And there's a reason we do. We're the only ones that do this that are in the Epic App Orchard. We developed this with Epic. So yeah, you want to sell your wares and you want to get your stuff out there, but you have to focus on integration and you have to focus on security. IT runs the entire hospital system. Whether we believe it or not, whether we like it or not, hospital IT controls all the strings. It's just the way it is.
Thank you.
Lou, it's number 5 or 4. You're on mute.
I've now beat you. When you think about selling to a health system, you've got different value propositions for each of those individuals sitting at the table, looking at the capital investments they're going to make, that following year. So you've got the CIO, and he's resource constrained, personnel constrained, risk averse. And then you've got the CFO, right? And you're looking for tangible metrics and KPIs that they can make a financial decision. The CEO is looking to innovate and to implement solutions that make him look good and that advance the hospital in terms of the competitive environment. So each of those has such a different sort of trigger point, if you will. And you also need the champion, right? So it's not always the CEO level, C level, right? You've got champions within the device clinic or the EP, but that rolls up to the executives within the administrative suite of a hospital system. So that's something I think that's really interesting, particularly for software companies, because it's regardless of healthcare, it's true of any software solution, but SaaS has changed that dramatically. But with a hospital, it's still a little bit of the same, dynamics relative to the sales cycle and, presenting a unique message and value proposition to each of those audiences, right?
Yeah, Nikki's asking the same question there in the chat. We've won deals coming from all of those angles. We've won deals from the bottom up, starting with the nursing staff that's overworked or someone has retired, and we've come through. We've won deals where we've started with the administrators and gone to the C-level and worked our way down. Intermountain Healthcare, we work with them out in Colorado and Montana, and we kind of came in from a higher level there. Ascension was a higher level contract and working our way down, but we don't lose sight of the fact, and I don't want anyone here to lose sight with the fact that we're taking care of patients. That's first and foremost what we do. And even though we talk about SaaS and we talk about contracts and all these kind of things, and it really doesn't matter which office you're in, you can always bring it back to the patient. If you're offering better healthcare that is better for the system, that's better for the patient, then it's a win-win all across the board. And I found that many of the hospitals will even see these, we're not a loss leader, but they're willing to even take a loss leader if it's better for the system and better for the patient in total. And sometimes it's understanding what type of system you're working with. Are they profit? Are they nonprofit? What is their end goal and what room are you in at the time? You certainly don't want to go in and meet with a group of nurses and talk about margins. And you certainly don't want to go into the C-level and just lead off with, this is going to be better for X, Y, and Z patient. They want to hear different things. So those were things that we learned, how to hone the message, who we're talking to, what needs to come through. But, to answer your question specifically, Nikki, you start with the physician They tend to be the key end user, and then you focus from there with our type of a product and service.
So
Right.
you basically start with the person that has the biggest kind of pain point, and then kind of work your way through
Yeah, I
to the
think
decision maker.
Yeah, pain point and ability to be your champion.
Yeah.
We look at it as needing multiple champions to move our deal all the way through the system. So you need a physician champion, you need an IT champion, and you need an administrative champion. Those
Yeah.
3 pillars are what we set up as our deal structure.
Mm-hmm.
Now, there are certainly other parts of that structure, and we roll that all the way back into HubSpot. And HubSpot, the way that we set up our deals board and the way that we move things through the cycle is pretty classic, but it's around those key pieces of movement that you have to take from a deal to move from what we have as a 1 to 5. And then it moves into onboarding, and we use HubSpot for that as well. And we use HubSpot for account management. There's a lot of things we do. But if you're missing one of those key pieces, say you've got a great administrator and you've got a great physician, but the IT team's not on board, the deal's not going to move.
Yeah.
Or you could have a great IT and you could have a great administrator. The deal will move faster, but until that physician is really bought in on what you're wanting to do in that system, it's tough.
Right. That makes sense. Yeah. And I think you kind of already half answered this question with that question, or with that answer, but I had put in the chat a little earlier is that with you guys being a technical tool, especially with technologies that are much more forward thinking and innovative using AI and machine learning, do you run into any roadblocks? Because I know with healthcare being such a highly regulated area, and a lot of times often is viewed as kind of being behind the game when it comes to technology and rolling things out. Do you ever kind of get certain people on board and then hit a wall when it comes to the technology itself? Or do you feel like as long as you have, once you get to the, say, chief innovation officer or the CIO, that they kind of get it and are kind of your advocate for the technology piece? Like, do you ever talk to the CEO or the physicians or whoever and you're selling it and they just don't understand the machine learning, the AI?
Yes. Yeah. Certainly you run into roadblocks, but in this case, it's more how you're going to use it. So 4 years ago, no one was talking about AI in this space. Now it's a common talk. There are other companies out there, like Implicity is one, and Cardio Logs is another company that has exited. That is one that has employed AI for very certain pieces of what we do. We're more global and we cover a lot more technology and a lot more cardiac footprint. But the biggest roadblock is, how are you going to use it? Where are you going to employ it? And then beyond that, it's there's still a little bit of a market angst that this type of information has been looked at by clinicians. And so we still do that. We have a clinician that looks at every piece of information before it goes out the door. We're not a full AI shop at this time because the market's not quite there. Doesn't mean that that's not our goal. And we're looking to develop newer pieces that will help everyone and help the entire system. But right now, we realize where the market is, and we want to stay in that lane with them. We don't mind being a fast follower in some of that, but in other cases, we're certainly leading.
It's great information.
Are there any other questions?
I think we've certainly covered a lot of material, and if there are no other questions, give you a countdown of 3, right, to ask any final questions. But we're very appreciative of everybody spending time with us today, and certainly Brian, we're delighted to have you on board, and Nikki, thank you for inviting me to be the chairman, and we're excited about a great year, and we'll start to focus a little bit more on specific marketing tactics and channels, SEO and marketing tech stacks and things of that nature. We wanted to sort of kick off the opportunity to talk about starting a business, growing a digital health enterprise on a holistic sort of strategic level. And so, but if you have any topics, please feel free to send them my way. Let me give you my email address real quickly, and you can reach out to me. And I probably have sent quite a few connection requests to each of you that I had a LinkedIn URL for, but we're excited. So next month, we're going to have the next meeting on the last Wednesday of the month. And I think that date is August 27th as well. So Nikki, are there any other comments or questions or suggestions from your perspective? And Dawn, I really appreciate it. Dawn Christie's been very instrumental in helping pull all of this together. So thank you, Dawn.
Yes.
My pleasure.
Yeah, thank you so much, Dawn. Yeah, I think this was really great. I found it to be actually super helpful and great information, Brian. I think almost anybody from any industry can kind of take some of this advice. I would say, just for anybody that's listening, please feel free, like, Lou opened up in the beginning just saying, let us know what you guys are struggling with, what you want to hear, where we can help you the most, because that's really the whole intention of these peer groups. And just letting us know how we can be the best resource for you, because that's really how we come up with a lot of the ideas in these peer groups of what to talk about and what speakers to bring in, is just what you guys are struggling with. So please don't feel free that you're going to bother us. Reach out and let us know.
Yeah, and Nikki, I just want to say again, thank you for having me this evening. What a great group that you guys have, and look forward to coming back and listening to some of your other presenters as
Yes.
you guys get this going through the year. And I put my LinkedIn in the chat as well. If there's a question that you have that you just didn't want to bring out, in front of the group,